Dr. Gostich, how do you decide between surgical and non-surgical treatment for a fractured ankle?
Well, I would say the vast majority of ankle fractures typically need surgical treatment. There are different levels of severity, but overall, I look for alignment and I look for stability of the ankle joint and ankle mortise. So, your ankle is comprised of your fibula and your tibia, and the fractures you can have are you can have a isolated fibular fracture, you can have a fibular fracture with a medial malleolar fracture, which is the inside of your tibia, or you can have a fracture of all three malleoli, which are your outside bone, your fibula, your inside bone, your medial malleolus, or the back of your ankle, your posterior malleolus, which is called a trimalleolar ankle fracture. Just by looking at different patterns of ankle fractures, we can determine inherent stability versus inherently unstable, and that can make a decision right away if it's surgical or not surgical. For instance, most trimalleolar ankle fractures are inherently unstable and usually surgical, unless there's some rare incidences where the patient is not a good surgical candidate or it's completely non-displaced and the patient chooses to not have surgical intervention and she opts for a cast. But for the most part, people recover better and faster with surgery for trimalleolar ankle fractures. I think where this gets interesting is if you have an isolated fibular fracture, then you really have to look at the ankle mortise, the alignment, and I think that's where a foot and ankle specialist really comes in because we know exactly what to look for. A lot of other physicians look and they think they see an isolated fibular fracture, but there may be a ligamentous component, maybe medial, or a small ankle fracture in the back. So in that case, we really look for ankle mortise alignment and stability, and there are different ways that we test that.